Hey y'all, welcome back for our daily practice questions. It is day 156, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. So we treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But don't forget to hit the subscribe button so you're not missing any of my videos. And if you need access to my MP Test Success Toolkit, it's free and linked in the description. Also, my updated website is linked in the description as well that walks you through all of the resources that will fit wherever you are currently on your road to MP. All right, question number one. A 45-year-old woman presents with right upper quadrant pain, fever, and has a positive Murphy sign. Ultrasound confirms gallstones and gallbladder wall thickening. What is the most appropriate initial management in the primary care setting? Is it A, start a high fat diet and refer to gastroenterology? Is it B, prescribe oral Cipro and send home with follow up in 72 hours? Is it C, refer to the emergency department for IV fluids, pain control, and surgical eval? Or is it D, begin metronidazole and discharge with a low fat diet? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate initial management in the primary care setting? So, I always tell you, if they're looking for a treatment, you need to run it back and see if they provide you with a diagnosis. If they have not, you got to run it back a step further and look at those assessment findings because you got to know what it is to be able to treat it. So here, the diagnosis is not provided. So let's see what the patient has going on. So we have a 45-year-old female who's come in, has right upper quadrant pain, fever, and a positive Murphy sign. So when I tell y'all to know the key identifiers, these already have two that should have stopped you in your track and made you think, okay, wait a minute. So right upper quadrant pain, we think cholecystitis, right? Make sure you know your abdominal quadrants and what pain falls into those areas. I do have like an image, a chart that I like to show reviewers that kind of helps you visualize it based off of where the organs fall and where the pain is elicited for certain diagnoses. But also a positive Murphy sign also confirms that cholecystitis. So then the ultrasound also is confirming that there's gallstones and gallbladder thickening. So how do we treat initially first line therapy in a primary care setting for somebody with acute cholecystitis? So your best answer will be C. You want to refer them to the ER for IV fluids, pain control, and surgical eval. This is an emergency situation. They need to be managed in the appropriate level of care. This is not where you're providing all of the treatment in primary care, okay? So although, again, I always tell y'all, just because we know what is to be provided, don't let that fool you on the answer choices. Remove yourself and remember where you're currently practicing because for board's purposes, that is outside of your scope. So refer out so those things can be done. All right, question number two. A 20-year-old male presents with periumbilical pain migrating to the right lower quadrant with nausea and a low-grade fever. He has guarding and rebound tenderness. What is the best next step for the suspected diagnosis? Is it A, to prescribe augmentin and observe at home? Is it B, to order outpatient abdominal CT and follow up in 48 hours? Is it C, to refer immediately to the ER for imaging and surgical eval? Or is it D, schedule elective appendectomy from 1 week? Let me say that again. D is schedule elective appendectomy within 1 week. Which one do you think? Tell me your answer in the comments. All right, so stem of the question here. What is the best step for this suspected diagnosis? All right, so we got to figure out what the diagnosis is because when it says suspected, that means they have not provided it for you. So we have a 20-year-old male who's come in. He has umbilical pain and is migrating to the right lower quadrant. Again, know your quadrants. Right lower quadrant is typically appendicitis, right? So with appendicitis, how do we treat? And your best answer is C. You're going to refer this patient out as well to the ER for imaging and surgical evaluation, okay? All right, lastly, question number 3. A 55-year-old patient presents with severe epigastric pain radiating to the back, elevated serum lipase, and a history of alcohol use. What is the most appropriate first step in management? Is it A, start oral pancreatic enzymes and outpatient GI referral? B, prescribe opioids and antiemetics for home use? C, refer to ER for IV hydration, NPO, and pain control? Or D, prescribe a proton pump inhibitor and a low-fat diet? Tell me what you got in the comments, y'all. All right, all right, all right. So, stem the question here. What is the most appropriate first step in management? So, again, let's see what this patient has going on. So, we have a 55-year-old patient, severe epigastric pain that radiates to the back, elevated lipase, and a history of alcohol use. Y'all, this is classic presentation for pancreatitis. So, in this scenario, we're going to also refer them to the ER for IV hydration, NPO status, and pain control. Again, the key that I wanted y'all to see here is even when you're studying things and you're working your way through all of the tiers, like I tell you, assessment, diagnosis, evaluation, and treatment. Even in scenarios like this, make sure when you're studying the treatment that you tell yourself, you know you are referring out for this particular management. Don't let yourself miss answers on exams, on the boards, simply because you're jumping into the step and picking the answer of the specific treatment and forgetting that you have to refer in your role, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio. You can give us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email. As I mentioned earlier in the video, the new updated website is live and it's linked in the description, which will navigate you through all of the resources and to better gauge exactly what you need. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.